All right, well, are you a little nervous about that nip and tuck? Well, there is a high-tech device designed to ease your fears.
It is called Vectra 3D, and one local plastic surgeon swears by it. And we sent CBS 13's Tony Lopez to check it out.
It's time to scrub inside the Aesthetic Artistry Surgical and Medical Center in Folsom. But before Dr. David Kaufman walks through the operating room door, he studies his window to the future. A click and peek of what his nip and tuck should look like. In this case, on a 30-year-old female, Tatiana, who wants her nose and chin done.
So I had recently gotten this technology, and I said, hey, Tatiana, you got to see this.
This is Vectra 3D imaging, where a patient, in this case, me, I'll show you what my nose job would look like in a minute, stands in front of what's basically a 6-foot-tall camera that captures a computer image of how you might look after surgery. Now back to Tatiana.
And this is ultimately what we decided is the plan for the surgery: removal of the dorsal bump, elevation of the tip, reduction of the projection, and then adding a chin to create more projection and a better balance in her profile.
This shows the before image from the Vectra 3D snapshot. Now let's show you how it turned out.
You can see dorsal bump gone, tip elevated, projection reduced, chin augmented, and while it's not, as I would say, as perfect as this, it's pretty darn close.
This machine also provides a side-by-side before and after.
But you can really see, nose is straighter now, tip is better defined, chin shape and profile is a little bit more of what she had hoped for.
To your right is the 6-month post-op image. Now, even though the Vectra 3D has been around a few years, this Folsom office is one of just a few in all of Northern California where you can find one in use, in part because it's so expensive. But the payoff? It takes the guessing game out of the question, I wonder what I'm going to look like after.
When you have a target to shoot for, it makes things much, much better. And this is a good way to show people what's possible.
Dr. Kaufman uses it for nose jobs, chin implants, and breast augmentation procedures, where he can show a patient what she might look like, say, in an after-surgery bikini pose.
So here's what they look like from the side. Here's what they look like from the front. If you want to get a sense of what you might look like at the beach, this is what it looks like laying down. So it's really pretty neat. It's a nice way for people to really get a sense of what's possible and how things will turn out.
Now back to how will I turn out?
So what I can do is I can narrow your nose, like so, and then maybe give the tip just a little bit more definition. As I'm getting to this point where I'm getting ready to save, the patient will say, hey, what about this?
What about my chin?
What about your chin?
Yes.
Well, here you go. A little reduction there, and an implant here, and there's my new look.
The nice part about this is, let's say you were an actual patient. We talked about this, we go over a plan, and as I'm doing this, I'm almost working out in my own mind technically how the operation is supposed to go to deliver this sort of result.
Results patients like Tatiana are pleased with, relying on a trusted doc and his trusty high-tech sidekick to take more than just a little off the top out of the makeover mystery.
This is never perfect, but it's very, very close.
Okay, so here's the big reveal. The swelling hasn't gone completely down yet, so no, of course I didn't get it done, but my wife says I'm perfect just the way I am. That's the reason
She's
why.
right. She's right.
But if you are interested in looking into this, again, it's new technology used here in Northern California. The whole thing with the body contouring, though, that's what they're trying to kind of pinpoint. It works really well with nose jobs and chin implants. They're trying to see if they can use it for body contouring. That's next, tummy tucks and things like that.
Wow, it's amazing what they can do, though.
But you don't need work.
No.
You don't.
Well, thanks.
Yeah.
I appreciate that.
Yeah.
Not now.
Tony, thank you very much.